Now, this is a story that's affected a lot of people, and perhaps an alarming number of people. For those who've got mental health problems, getting help and timely help being the key nuance here, we've said that word a lot this morning, isn't always easy. A couple of years ago, Caroline Aldridge wrote a book telling the story of her son Tim and his experiences trying to access help before he died in 2014. And the book really rang true for quite a lot of people who started contacting Caroline to tell her their stories. One of those people was from Shropshire. Those stories have now been put together by Caroline into a new book to try and educate and inspire people to change the system. Caroline's on the line now. Good morning.
Good morning.
Tell us how this started. Tell us about Tim, what happened to him, the issues that he had and the problems that he faced.
Okay, so Tim had bipolar disorder, and like many people with bipolar disorder, he didn't get a diagnosis for a long time, so he self-medicated with alcohol and then some drugs. I describe him as never being the right kind of ill for services, so although he was very unwell for 15 years, he never really accessed any proper help or support. And you know, sadly he died, which was just devastating for us as a family. And it's a long and painful journey when you lose someone to mental health-related illness. And eventually, following a head injury where I needed to do some rehabilitation and learn to use the computer again, I ended up writing his story into a book. He died waiting. And I always knew there were other people, and more I became aware of other people who had similar losses. But I appeared on Radio 4 Women's Hour, and I had all these inquiries, and one of them was Sam's mum, Heidi's mum, who bought the book, and then Heidi got in touch with me to say, your story is very similar. Sam's life and death was very similar, and sadly it was. So I've ended up sort of gathering together these people's stories because they're so important for people to be aware of and to learn from. And it's been an absolute privilege, really, to connect with people all over the country.
How into the system was he when he died? What was he waiting for, or had he never been brought into the health system as a whole, I guess?
So Tim was waiting. He died waiting for an appointment. His appointments were, I've described them as episodic. They were like a revolving door of waiting for an appointment. By the time that came, he was either too unwell to attend or had recovered enough for them to say, there's not much wrong with you, off you go. So he really got virtually no help in 15 years. But in the last few months of his life, he was trying really hard to get into a service, and he died before that appointment ever came. And the story is very similar with Sam, who died waiting for somebody to understand how at risk he was and to step in with the right interventions and support.
I asked this for a reason. What was his cause of death?
Well, Tim, we'll never know. It was unascertained. So we just don't know because he wasn't found for nearly a week, which was just awful, really. Mm.
And I ask that because it's so complex. You know, even in this story, we've spoken about, diagnosed and complex mental health problems. We've spoken about the involvement of alcohol and drugs in a lot of these stories as people, as you say, turn to self-medication. And obviously a system that I think it's probably fair to say is not necessarily able to cope with the demands placed on it. And having spoken to a lot of mental health professionals over the years, I think the majority that I've spoken to would concur. Are all of the stories very similar, or because each individual case is so different and complicated, do they differ in certain ways?
Yeah, there are similarities that run through some of the stories. So there are a number of stories a bit similar to Tim, but some are very different. So the book covers deaths from dementia, eating disorders. So some are suicide, some are we don't know. And I think that's one of the painful things for mental illness-related deaths, is often it might be down to self-neglect or a natural cause like a heart attack because somebody has not been eating or sleeping or taking their medication or the side effects of their medication. So there are similarities and threads in the stories, but the common connecting thing is love. So what comes shining out of all the stories is no matter how judged or stigmatised the people were when they were alive, they were very loved and valued by their families and their friends. And that love equates really to a pain of grief. When you love, you grieve. And the other thread that runs through all the stories is hope. The different things people have done and are doing as a result of having gone through these really terrible times.
And you want to change things for the better, don't you? You want to make sure that it doesn't happen to anyone else. I wonder what you've learned from these stories. Now, I was speaking to a nurse the other day who was saying that basically specialist hospitals for mental health problems, often the nurses there aren't necessarily skilled to do the physical health side of things, which often comes with the mental health problems. So the person gets caught between a hospital and a mental health facility and ends up, thriving in neither scenario. And there are issues with joined up, services or a lack of joined up thinking. What have you learned from all of this practically that we could do as a society?
Yeah, I agree with all of that. And we've definitely got stories in the book where people have died. Peggy, aged 81, who was literally dying beside the people that were transporting her between hospitals, and they didn't notice she was dying because they were thinking about her behaviours in terms of mental health. So I've learned that really there's no one answer. This is, for me, I do a lot of work now. I go in, I gave up my job, I go in and do workshops and things with mental health trusts and other organisations, and my key message is it's about kindness and values. If whatever work we're doing, if we come at it with a kind heart and a really good set of values, we then automatically want the best for the people we're working with. We automatically then see them as people, as human beings who have physical and mental health needs and families and strengths and skills and talents and all the other stuff that gets lost when someone's very unwell. And we make better decisions because we want to keep them safe and we want them to be able to enjoy life. So if I could change one thing, it would be around people being more compassionate and kind and going into every interaction thinking, how can I do the very best for this person today? And as one of my people in the book wrote, she said, good care is not that complex. Listen, be respectful, don't judge, and do what you say you're going to do.
It's quite interesting that, what you've just said there has nothing to do with funding. A lot of people say, people don't enter crisis 9 to 5 and we need more funding. But for you, it's a mindset. It's a cultural thing. Yes,
absolutely. It is, but it also needs funding. So I know one of my contributors to the book has spoken to Jeremy Hunt and Sir Keir Starmer and said, what are you going to do? Because we do need funding, but it needs to be used wisely, and you can have all the funding in the world, but if the culture is not kind and doesn't value people and isn't curious about why people are presenting the way they are and looking for the reasons behind the behaviours and willing to go the extra mile and not be another person in a long list of people that have let the person down, that for me would be the thing that makes the biggest difference.
Just finally, how important has it been in this book to tell people's stories? Because I always feel that at this point in interviews like this, I need to kind of say, look, tell us a little bit about the person you lost, because it's really easy to say, okay, Tim, drug user, somebody with a mental health problem, and allow the things that eventually were his undoing to be defining. Whereas for you, I would imagine they come way down the list of things you would use to describe the human being. So tell us a bit about him.
Tim, he was kind, clever, quirky. He wanted to be a doctor, and if somebody had addressed his mental health early on, he had all the capacity to have done that with his life. But he had immense value to his friends and family. He was very unwell, and yet amongst his friends, he was the one who did a lot of caring for other people, and would do things like writing letters to the benefits office on his friend's behalf. You know, he had such a lot of skills, but he was just a champion hugger, and yeah, really loved.
Caroline, it's lovely to talk to you, and good luck with the book, and thank you for giving up some of your morning.
Thank you very much for having me on. Thank you. Bye-bye.
No problem at all. Caroline Aldridge, whose latest book, They Died Waiting, The Crisis in Mental Health, Stories of Loss and Stories of Hope, is out now, and it's something that tells human stories, people's stories. And if you want to find out a little bit more about some of these issues in society, and it's a big issue in society, isn't it, as we try and get to grip with mental health and where it fits into the health system. You know, comparatively, it's still pretty new, isn't it? A lot of, you know, the understanding of some of these conditions is still fairly limited. So if you want to find out a little bit more, seek out the book and the previous book that Caroline wrote about her son Tim. It's called He Died Waiting as well.